Assalamu alaikum. Welcome to my video lecture class. I am Professor Dr. Muhammad Ashfaqur Rahman. This is the skull. We can see this is skull, or it is also called cranium. And the bones forming the skull can be divided into two groups. One is the neurocranium, another one is viscerocranium or facial bones. The bones of the neurocranium are frontal bone. These are two parietal bone. This is the occipital bone. Then sphenoid bones, temporal bone and ethmoid bones. These are the bones of the neurocranium. So we can see this is the frontal bone, which forms the frontal part or front of the vault of the skull. This is called vault of the skull, and frontal bone forms the anterior part of the vault of the skull. And these are the parietal bones. They are located on the superolateral aspect of the vault of the skull. And this is the occipital bone, which forms the posterior part of the vault of the skull. So today we will discuss on the parietal bone. Parietal bone is a bone of the neurocranium, and it forms the superolateral aspect of the vault of the skull. Here you can see there are two parietal bones together, and now I am going to separate them. So these are two parietal bones. This is the right parietal bone and this is the left parietal bones. Now let us take one parietal bone. So this one is the parietal bone. This is the left parietal bone. I am holding the left parietal bone. This is a bones of the neurocranium, and it is located on the superolateral aspect of the vault of the skull. We can see the shape. What is the shape of this bone? This is a quadrilateral bone. The shape is quadrilateral. And what is the type of this bone? It is a flat type of bone. This is a flat type of bone. So now we want to know the structure of this bone, structure of flat bone. It is frequently asked in the any viva examination. What is the structure of a flat bone? A flat bone consists of three layers. Namely, this is the outer layer. It is called outer table. This is the outer table of the compact bone. And this is the inner layer. It is called inner layer of compact bone. And in between them there is a layer of the spongy bone, which is called diploe. So there are three layers: outer table, inner table, these are compact bone, and middle spongy bone. But spongy bone is called diploe. So the structure is almost like a sandwich. In the breads of the sandwich represent the outer and inner table, and in the middle it may be vegetable or meat or egg. If it is egg sandwich, then the egg represent the diploic space, and in the diploic space or in the diploe there are red bone marrow throughout the life, and here hemopoiesis occur throughout the life, hemopoiesis, and the veins draining the diploic space are called diploic vein. So we have discussed about the structure of this bone. That is it is a quadrilateral bone having three layers: outer and inner compact bone, and in the middle there is the spongy bone. Now we want to see the morphology of this bone. Morphology. As it is a quadrilateral bone, it will have four borders. What are those? This is the anterior or frontal border. This is the superior border, this is the posterior border, and this border is the inferior border. So there are four borders of this bone. So anterior, posterior, superior and inferior. So there are four borders. Now let us discuss about the borders. Anterior border, this is the anterior border. It forms joint with the frontal bone. It meets with the frontal bone and forms the coronal suture. Here we can see this is the parietal bone and this is the frontal bone. Anterior border of the, here we can see this is the anterior border of the parietal bone, which forms joint with the frontal bone and forms coronal suture. And coronal suture is a type of the serrate suture, serrate kind of suture. So this is the anterior border. Next, this is the superior border. We can see this is the superior border. And with the superior border, it articulates with opposite parietal bone and forms the sagittal suture. Sagittal suture. You can see here, with this border, with this superior border, it articulates with opposite parietal bone and forms sagittal suture. Sagittal suture is also serrate type of suture. And near the posterior part of the suture, there is an opening. We can, I am showing you the opening here. This is an opening. Look, this one. This is an opening. This opening is called parietal foramen. Parietal foramen. On the both sides, two parietal foramens. Here is another parietal foramen. And the part of the sagittal suture containing the between parietal foramen is called obelion. It is called obelion. So this is the superior border. Now this is the posterior border of the parietal bone. Posterior border. With this border, it articulates with the occipital bone and forms the lambdoid suture. Lambdoid suture is one kind of the dentate suture. Lambdoid suture is dentate type of suture. Here we can see in this skull, this is the posterior border from here to there. This is the posterior border of the parietal bone, and by this border it articulates, parietal bone articulates with the occipital bone and forms the lambdoid suture, which is the dentate type of suture or denticulate type of suture. Now inferior border of the parietal bone. Here this is the inferior border. Look at this one from here to there. This is the inferior border of the parietal bone. This inferior border forms three joints. The anterior part of this border forms joint with the greater wing of the sphenoid, and the middle part of this border forms joint with the squamous part of temporal bone. These two joints are the squamous type of suture, squamous suture. And the posterior part of this border, here this part, this articulates with the mastoid part of the temporal bone and forms parieto-mastoid suture. Parieto-mastoid suture. This is the limbus type of suture. So it is frequently asked in the Viva examination that what are the joints formed by the inferior border? Inferior border forms three joints. With the front anterior part, it articulates with the greater wing of the sphenoid, and the middle part articulates with the squamous part of the temporal bone, and the posterior part articulates, this part articulates with the mastoid part of the temporal bone and form parieto-mastoid suture, and the anterior two sutures are the squamous type of suture, posterior one is the limbus type of suture. So these are the borders of the parietal bone. Now we are going to what are the angles of the parietal bone. There are four angles of this bone. This is called anterosuperior angle. This is called anterosuperior angle, and this point is also called bregma. The point is also called bregma. This is the posterior-superior angle. This is posterior-superior angle, and this angle is also called lambda. This point is called lambda. This is the antero-inferior angle. It is antero-inferior angle, and this angle is called sphenoidal angle, or it is also called pterion. Pterion. This is called pterion, and this angle is called posterior-inferior angle. Here is the posterior-inferior angle. It is also called asterion. So four angles have four names. This is bregma, lambda, pterion, asterion. So these are all about the angles. Now we are going to surfaces. As we see here, it has two surfaces. This surface lies externally, so this can be called external surface, and this can be called internal surface. So there are two surfaces of the parietal bone, external and internal surface. If we see here external surface, this is smooth. This surface is very smooth in shape, and there is a elevated area of this surface, and this surface is convex, and maximum convexity is here. This area is called parietal tuber, parietal tuberosity, or parietal eminence. So this is the parietal tuber, parietal tuberosity, or parietal eminence. This is the first feature of this surface. Parietal tuberosity has some importance. What are those? These are very important for the viva examination as well as OSPE examination. Parietal tuberosity has some importance. Number one, it is the commonest site of fracture of this bone. If somebody struck you with a rod or with a stick, this area is commonly injured and fracture commonly occurs here, as it is the projected area of this bone. So it is the commonest site of fracture of this bone, number one. Number two, the ossification of this bone start here in this area. Ossification start here. Number three, this area is used to determine the biparietal diameter of the head during the antenatal checkup of the pregnant woman, so that they can plan or they can find the disparity between the diameter of the pelvis and the diameter of the head of the baby. And this will help in the making decision whether normal delivery is possible or not. So this area is used to measure the biparietal diameter of the baby during intrauterine life in the antenatal checkup. Moreover, below this area, sensory speech area of the brain is located here. Sensory speech area of the brain is located here below the parietal tuberosity. Now, so I have discussed about the four importance of the parietal tuberosity. Below parietal tuberosity, there are two lines. One is this one, superior temporal line, and another one is inferior temporal line. These are two curved lines below parietal tuberosity on the external surface. Superior temporal line gives attachment to the galea aponeurotica, and the inferior temporal line gives attachment to the temporal fascia and the temporalis muscle. In fact, this whole area is giving attachment to the temporalis muscle. So superior temporal line gives attachment to the galea aponeurotica or epicranial aponeurosis, and inferior temporal line gives attachment to the temporal fascia and temporalis muscle. Now we are going to the internal surface of this bone. Internal surface, we can see near the anterior border of the internal surface, there are some vascular markings. There are some vascular markings near the anterior border of internal surface. These are the markings of the middle meningeal artery or middle meningeal vessel. Middle meningeal vessel has two trunks or division. One is the frontal trunk, another one is the parietal or posterior trunk. Frontal or anterior trunk, parietal or posterior trunk. So this is the anterior division or anterior trunk or frontal trunk of the middle meningeal vessel. This is located near the anterior border on the internal surface of the parietal bone. Then near the posterior border there is another groove. This is called groove for sigmoid sulcus. This is the groove for sigmoid sulcus. It lodges sigmoid sinus. Then in the middle of the inferior border, another vascular marking which can be seen passing upward. These are the marking for the posterior or parietal division of the middle meningeal vessel. So this is the anterior division of the middle meningeal vessel. These are the posterior division of the middle meningeal vessel. Now near the superior border here, half groove can be seen. It is a half sulcus. If we connect two bones with each other, then full sulcus will be formed here. There will be a full complete sulcus will be formed here. This is the superior sagittal sulcus. Superior sagittal sulcus. And superior sagittal sulcus lodges the superior sagittal sinus. This sulcus lodges superior sagittal sinus. And the lip of the superior sagittal sulcus gives attachment to the fox cerebri. Fox cerebri. On each side of the superior sagittal sulcus, there are some pits or openings, which openings are called arachnoid foveoli. These are called arachnoid pit or arachnoid foveoli. These arachnoid pit or foveoli lodges the arachnoid granulations. Arachnoid granulations are nothing but collection of the arachnoid villi. So this is all about the internal surface of the, what I can say, parietal bone. The internal aspect of the parietal bone lodges the parietal lobe of the cerebral hemisphere. So now we are going to the ossification of the bone. What about the ossification? These bones ossify by the intramembranous ossification. And it develops from the somatomere, that is, it develops from the parexial mesoderm. It is a mesodermal bone. We know frontal bone is the neural crest derived bone, it is ectodermal, whereas parietal bone is it develops from the mesoderm, it develops from the parexial mesoderm or somatomere. One primary center appear during the 6th week of intrauterine life, and it appears near the parietal tuberosity area. Then intramembranous ossification occur. These spread outward, and these angles get ossified lastly. So during the birth process, this area becomes unossified, and these areas are called fontanelli. So in short, parietal bone developed by the intramembranous ossification. One primary center appear at the 6th week of the development, and the ossification method is the intramembranous ossification, and it develops from the parexial mesoderm. So it is a mesodermal bone. Last of all, what about the anatomical position? In the anatomical position, the external surface is convex and smooth, internal surface is concave. First of all, we have to determine which surface will be external, which surface will be internal. So external surface is convex and smooth, internal surface is concave. Now we must determine which will be the inferior border, like this. Anterior inferior angle, we will take the help of the anterior inferior angle. So anterior inferior angle is sharp, projecting downward more. This is the posterior inferior angle, but anterior inferior angle is sharp and more projected downward. And inner aspect of this angle, inner aspect of anterior inferior angle is marked by a vascular marking, which is the marking for frontal division of the middle meningeal vessel. And the posterior inferior angle is marked by sigmoid sulcus or sigmoid groove. So I am repeating this again. External surface is convex, internal surface is smooth. Anterior inferior angle is projected downward more, this angle is sharp, and inner aspect of this angle is marked by frontal division of the middle meningeal vessel, and the posterior inferior angle is marked by sigmoid sulcus. So this is all about the parietal bone. This is the end of my lecture. Thank you very much for watching my video class. See you later in the next class. Thank you. Assalamu alaikum.